We're very pleased for this session to have Dr. Nezami. Dr. Nezami has been a member of our group for a year, and he's doing some really wonderful work out in Fresno, California, and he's here today to talk about genetics and epigenetics. Please give a warm welcome to Dr. Nezami.
Thank you, thank you. You know, my objective and outlines was to clarify some misconceptions about integrative oncology. I think integrative oncology is and must be the way to treat every cancer patient. It's not optional. I don't think it's an option and should not be given as an option to an oncologist to treat a patient just by what is called the standard of care. I think it must be combined with other integrative therapies. So when you're talking about, okay, what as non-conventional practitioners, as alternative physicians, as physicians that look outside the box, we know that what we have, what we do, what we act, what is combination of environment and genes, right? But this is just the whole concept. The whole picture is that when you have this part of your system controlled by environment and this part is by the genes, when you interact the genes and the environment, then you have the disease or basically your presentation of those genes. But to explore that, this is basically outside the genes. So when we're talking about epigenetics, we're talking about outside the genes, outside the DNA that controls the DNA and is inherited. So it's not in the DNA, but it's inherited, and it can pass along to the next generation through non-DNA component of the epigenes. But if you look at the literature, you see that the SNP changes in the genes can be prognostic, can determine the treatment response. So genetics is important because otherwise you don't know which patient is going to respond to which treatment, right? There is actually a study showing that even looking at the glutathione S transferase can be as prognostic as biopsy. So you have a patient who has a high PSA and the biopsy is negative. And then you look at the glutathione S transferase, the data shows that if you see polymorphism of this SNP, that is equivalent to having a positive biopsy. So now we're talking about genetics playing such a big prognostic role. Metastases, I can show you how much the epigenetics are involved in metastases of cancer. And then cancer prevention, when we're talking about prevention of cancer, how you can prevent that. Cancer progression and survival, cancer response to the treatment. So when we're talking about response to the treatment, it becomes extremely important because I'll go over a case that I just recently saw 2 weeks ago. She came from Bay Area. She has BRCA positive, recurrent, resistant ovarian cancer, status post-platinum and Taxol treatment that is BRCA positive. And nobody had a clue how to treat her. And I came up with the action plan, sent it to the same oncologist who wrote me back a few months ago that I don't want you to touch my patient. And he looks at it and, well, of course, I didn't listen to him because that's my patient, right? But then he looks at my action plan to this resistant case and he sends me a Bravo email that I had never seen such a protocol. We will definitely follow your recommendations. And that's the Stanford and Palo Alto oncologists. So if you look at the cancer response to the treatment, that's the pitfall. That's the problem with the oncology in general, is that it's not customized, as you know. They don't want to know about the genetics. They don't know about the epigenetics if they want to. They're not taught in the medical school. They're not taught in the residency. And so you have to educate them. It is your responsibility as a non-conventional oncologist or cancer care physician to educate and train them. So you need to know the literature, you need to know the science, and you need to sit down and spend time, do the research, talk to them, and convince them, because this, at the end of the day, you want to have a patient who responds to your treatment. That's the goal, right?